Hi, in this video I'm going to be talking to you about colic in babies, what causes it, what the signs of colic are, and what you can do to help soothe your baby. If you're new to my channel, hello and welcome. My name is Anja and I'm a hypnobirthing practitioner as well as a baby yoga and baby massage instructor. I bring out a new video on my channel every single Tuesday, so if pregnancy, birth and motherhood are your thing, please consider subscribing and clicking the bell icon so you don't miss my weekly videos. Colic is when a baby cries a lot, but there's no clear reason why. Scientific research has not been able to pinpoint exactly what causes colic in babies, but it's thought to be linked to digestive issues and trapped gas in babies under 3 months of age, and possibly food allergies or food sensitivities. Colicky babies can be really irritable and fussy, and they can cry for up to 3 hours a day. My daughter had colic as a little baby, but thankfully I found ways of being able to identify colic and be able to deal with it effectively. If your baby has colic, you'll probably notice the following symptoms. So like I said before, your baby will cry, but the crying will be intense and it can go on for a few hours in a row. You may notice that your baby turns blotchy red and arches their back while crying. You may also notice that your baby brings their legs up to their tummy and clenches their fists. Other signs of your baby having colic are that they're difficult to soothe or settle, their tummy could be making rumbly sounds and they may have a lot of trapped wind, but otherwise your baby appears well and they have no signs of sickness or fever. Though it may not be easy to begin with and you may have to do a few different things to see what works best for your baby, there are lots of ways that you can help your baby with colic. So the first way that you can help your baby with colic is to try feeding them in an upright position. So if you're breastfeeding, feeding your baby like this can be really effective because it stops your baby from swallowing too much air, which can cause trapped wind and colicky symptoms. But if you're finding it too difficult to feed your baby upright, if you feed your baby on a diagonal rather than lying completely horizontal, that's also going to help to reduce symptoms of colic. And if you're bottle feeding your baby, if you can elevate your knees in some way, maybe just place your baby on top of your legs like this in a more upright position, that can really help to reduce symptoms of colic as well. Feeding on demand is usually better with colicky babies rather than having scheduled feeds. This means that your baby feeds when they're hungry until they're satisfied, and this means that their digestive system isn't overwhelmed and they're not taking on too much milk in one go. Please try to remember to burp your baby after every feed. This ensures that any air is released through your baby's mouth before it moves further down the digestive tract, gets stuck and causes your baby pain. To burp your baby successfully, it's best to place your baby over your shoulder like this with their chin balancing on your shoulder. Don't turn your baby's head to the side, keep it in a straight line, and then rub your baby's back with like moderate pressure in a circular motion rather than tapping. So rubbing your baby's back like this is a much better way of being able to release any trapped wind. Keeping your baby in some kind of upright position for up to 15 minutes after feeding can also be great at helping to reduce colicky symptoms. So placing your baby in a sling or a baby carrier can be really effective, especially if you need to have your hands free to complete other household tasks. Placing your baby in a sling or baby carrier can also help them to stay asleep if they've fallen asleep during a feed. If your baby is crying a lot with colic, using distraction techniques can be really helpful, and this was especially beneficial when my daughter had colic. So singing to your baby, giving them a toy to play with or look at, putting your vacuum cleaner on, looking in the mirror together, playing white noise, things like that can help to divert your baby's attention away from any discomfort that they might be in. Taking your baby for a walk in the pram can often help with colic as the noise and vibrations can soothe them. You can also rock your baby doing a gentle swaying motion like this. And I can't begin to tell you how many times I did this when my daughter was under 3 months of age. Back and forth, so many times. If you're concerned that your baby has an intolerance to foods that you're eating that are entering your breast milk, The best thing that you can do is keep a food diary and note down what you're eating and when your baby seems to be experiencing more severe colicky symptoms. Then make an appointment with your doctor, talk it through with them, and they may suggest that you eliminate certain foods from your diet for a while to identify what could be causing colic in your baby. And if you're formula feeding your baby with cow's milk, your doctor may suggest a non-dairy alternative. And another great way of helping to reduce colicky symptoms is to give your baby a warm bath followed by a tummy massage. And to find out how to massage your baby effectively to help reduce colic symptoms, please check out the video that's popping up on the screen right now, but I'll also link it in the video description below. Now, the good news is that as your baby's digestive system matures, they'll usually outgrow colic by the time they're 4 months of age. But whilst it's going on, it can feel never-ending, really tiring, upsetting and overwhelming. But I'm hoping that the tips that I've shared with you today will help you through the time with a colicky baby. Believe me, I've been there. It was really hard for me as well, but the tips that I've shared with you in this video really helped me, and it drastically reduced my baby's colicky symptoms. If you've got any questions about colic, pop me a message in the comments section beneath this video and I'll reply as soon as I can. Thank you so much for watching this video today, and see you in my next one.